How to reduce the risk of stroke. A stroke is a disruption of blood circulation in the brain that can lead to serious consequences, including paralysis, loss of speech, and even death. Unfortunately, stroke is one of the leading causes of disability and death worldwide. However, most cases of stroke can be prevented by taking necessary measures to reduce the risk of its occurrence. In this article, I will discuss the factors that increase the risk of stroke and the steps that can be taken to reduce it. Risk factors for stroke. There are several factors that can increase the risk of stroke. Some of them are unchangeable, meaning we cannot alter them, but there are also those that depend on our lifestyle and that we can control. Unchangeable risk factors. 1. Age. The risk of stroke increases with age. Most strokes occur in people over 65 years old. 2. Gender. Men have a higher risk of stroke than women. However, the risk for women increases after menopause. 3. Heredity. If your parents or close relatives have had a stroke, you have an increased risk of developing one. Changeable risk factors. 1. Hypertension, high blood pressure. This is one of the main risk factors for stroke. High blood pressure damages blood vessel walls and can lead to blood clots that may block blood flow to the brain. 2. Diabetes. People with diabetes have an increased risk of stroke due to damage to blood vessels and the nervous system. 3. Smoking. Tobacco smoke contains toxic substances that damage blood vessel walls and increase the risk of blood clots. 4. Physical inactivity. Lack of physical activity can lead to obesity, high blood pressure, and increased cholesterol levels, all risk factors for stroke. 5. Poor nutrition. Consuming large amounts of fats and salt can lead to increased cholesterol and blood pressure levels, which raises the risk of stroke. How to reduce the risk of stroke? By following simple recommendations, you can lower your risk of stroke and maintain your brain health. 1. Maintain a healthy lifestyle. Eat properly, avoid harmful habits, maintain an optimal weight, and engage in physical exercise. 2. Control your blood pressure. If you have high blood pressure, follow your doctor's recommendations and take medications to lower it. 3. Monitor your blood sugar levels. If you have diabetes, keep track of your blood sugar levels and take necessary measures to control them. 4. Quit smoking. Smoking increases the risk of stroke, so if you smoke, try to quit or seek help from a doctor. 5. Consume alcohol wisely. Excessive alcohol consumption can increase the risk of stroke, so limit your intake. 6. Regularly undergo medical examinations. Regular checkups can help identify risk factors and prevent stroke development. 7. Watch for symptoms. If you experience signs of a pre-stroke, such as dizziness, weakness on one side of the body, or speech difficulties, seek medical attention immediately. Stroke is a serious condition, but most cases can be prevented by following simple recommendations to reduce risk. Take care of your health and remember that prevention is better than treatment.